Well, one thing I can jump in and say is that with BCRF funding, the bigger collaboration and the North American Intergroup and the bigger collaboration is actually looking specifically at male breast cancer. It's a little bit, let me say it differently, I'm sheepish bringing this problem to this group. Male breast cancer is a rare problem. And from a public health point of view, it will always be a rare problem. It just isn't our problem. We have other problems, many, but not that one. So understanding whether the biology of male breast cancer is similar or different to that seen in women is something that's never been carefully explored. We've always assumed that men were just postmenopausal women. You know that. We've all done that for years. It always gets a laugh, that line, but we've been saying it for my whole career. That's how we treat men with breast cancer. So there's a lovely tissue repository being built at about 5 or 6 sites with BCRF support. And once the tissue is aggregated, investigators both in Europe and in the U.S. Are going to interrogate that tissue and ask how it corresponds to the known tissue that they've also banked. I think that's a first step towards the answer to your question broadly. On the narrow issue of BRCA status, which I think you were also getting at, I don't know whether there's enough experience anywhere to even address this, is there?
Well, I think that David Livingston was telling you that, BRCA1, the men don't tend to get breast cancer. In BRCA2, they can, the BRCA2, so that's certainly something that should be tested. But if you look at all men with breast cancer, only 15% of them are going to have a BRCA2 or BRCA1. So there's clearly something else going on that's causing male breast cancer, and even within families. So we don't know.
We have a biased ascertainment in Memorial for obvious reasons. So we have a large Ashkenazi Jewish population, and at least in our world, if a man has breast cancer, we test him, 100% of the men. And I think, and you guys can correct me, I wouldn't mind being wrong, but I think the incidence of BRCA mutation in men with any first-degree relative is 30% actually, which is about the highest it gets. Right, so there's a very high association of male breast cancer with the mutation compared to what we see in women. So there may be a clue in that to all of breast cancer. That's really what we're driving at.
Do older men are there more men who get breast cancer who are older?
So the age distribution of men with breast cancer, I have to admit I don't know the distribution. What do you think, David? I have a whole range in my practice.
No, in fact,
they're young? Right, well now we're on to another genetic evidence. Yeah, but I will tell you, I have young guys in my practice, and I have men in their 8th decade of life, and I don't know that there's a maldistribution, right? Okay.